Okay, hi to everyone who's joining this webinar. Welcome to everyone who's joining us live and to anyone who's watching the recording later on. My name's Louise Holly. I'm a Policy and Research Coordinator with Digital Transformations for Health Lab, or DTH-Lab. It's a real pleasure to be here for the second part of our research dissemination series. Today we're going to be joined by 4 of our amazing research fellows who've worked with us over the last year on different projects. Before we hand over to them, I'd like to invite our Executive Director, Afrodita Bertucci, to share some opening remarks about the fellowship and how it fits into the work of the lab.
Hi, Louise. Thank you very much for the introductions and for being the moderator today. And thank you to everybody who's joining us. So as Louise said, I'm Afrodita Bertucci. I'm the Executive Director of the Digital Transformations for Health Lab. And where today's event is all about showcasing the incredible work that's being done by our research fellows and the impact they're making in the world of digital health. So at DTH-Lab, we are driven by a very clear and ambitious vision, which is that digital transformations for health are led by health for all values. And those health for all values will enable digital-first health systems to deliver equitable benefits for the health, well-being, and safety of young people and their communities. Now, this vision is inspired by the recommendations of the Lancet and Financial Times Commission. There was a report that was launched in October 2021 on governing health futures. And the DTH Lab is a direct outcome of that Lancet and Financial Times Commission work. And we are committed to turning the ideas and visions and concepts from the report and the recommendations into reality. So how do we work? As a lab, we take a multidisciplinary approach to achieving our goals, and we focus on 4 key areas. You'll have the opportunity over the 2 sessions to hear about our different work streams. But in a nutshell, we look at building digital-first health systems, where we are co-creating them with and for young people. We engaging them to harness their perspectives and ideas to ensure that digital-first health systems are responsive to their unique health needs, and also to empower them to become enfranchised digital citizens for health. We also look at in advancing value-driven governance of digital transformations for health, where we build trust in health ecosystems and maximize the public value and health benefits of data. We work together with partners such as University of Vienna in this case, and we develop and test governance frameworks, have guide policy regulations for the use of digital technologies. Digital determinants of health is a term that was coined by the Lancet and Financial Times Commission, and we're exploring how digital technologies impact health outcomes. Again, this is something you'll hear from our research fellows. And last but not least, we look at digital citizenship for health, where we bring together with partners, we develop tools that involve the intersection and combination of digital health and civic literacy to empower young people to become informed digital citizens. So today we are here to look at our research fellowship program, to hear from our research fellows. And this is part of our strategy. We have a research fellowship program, which is designed to nurture the next generation of health leaders and researchers. So in 2024, we welcomed 9 talented fellows from Africa, Asia, and Europe who've been working on innovative digital health projects. So over the 2-part dissemination, you will be hearing from our fellows and explore how their research can shape the future of health. So again, I want to extend my heartfelt thanks to our research fellows for their dedication and hard work. Their contributions are invaluable to our mission, and I'm very excited to see how the research will impact the world. So again, thank you to everybody, and please, I invite our first research fellow to present.
Thank you so much, Afrodita. Before we hand over, just to give a little bit more of an introduction, today we're going to hear about 4 pieces of research that have been carried out. 2 are looking at approaches to digital transformation of health systems in India and Nigeria, which are 2 countries that are important to DTH-Lab, particularly because of their very large youth populations. So first we're going to hear from Helen Adesoba, who's a public health researcher and health economist. She's going to be presenting the research that she's done on digital first health systems in Nigeria. Then we're going to move to Anyesha Mitra, who's a social impact professional from India. She's been investigating what's happening in India with regards to digital transformation of health systems and the extent to which these developments are youth-friendly or not. Then we're going to move over to presentations on 2 cross-cutting issues that are really integral to all of the work that DTH-Lab is doing. First is the topic of digital health citizenship, and Racheal Ogundipe, who's a public health professional and researcher at the University College Ibadan. She's going to be talking about the scoping work she's done to look into current sort of tools and approaches to digital health citizenship. And then finally, we're going to be looking at the issue of trust, which is a vitally important issue for all aspects of digital health and digital transformations of health. And there we'll hear from Rupal Jain, who's a sustainable development practitioner with a PhD in public policy. And she'll be talking through the concept of trust and how it relates to the work that we're doing. So with that, let me hand over first to you, Helen, to tell us about the work that you've been doing in Nigeria. Over to you.
Thank you so much, Louise. I am Helen Adesoba, and the topic, the title of the study I worked on is Toward the Digital First Health System in Nigeria. So 1/3 of the population of Nigeria, the most populous country in Africa, is aged between 10 and 24. And the Lancet Commission on Adolescence and Well-being has ranked Nigeria as a multi-burden country concerning the health status of its youth. Among the primary health challenges facing Nigerian adolescents and young adults are sexual and reproductive health concerns, trauma and injuries, mental health issues, substance abuse, and dietary problems. The widespread of mobile devices in Nigeria, with 90.7% of the population owning a mobile phone and 45.5% having internet access as of early 2024, offers a significant opportunity to enhance access to quality healthcare for adolescents and young persons through digital technologies. Recognizing this potential, Nigeria has begun to make strides toward digital health transformation by implementing initiatives such as National Health ICT Strategic Framework and introducing digital platforms aimed at improving health service delivery. Examples include the health application, telemedicine platforms, and digital registries. With the increasing adoption of mobile health solutions and improved broadband access, identifying digital health interventions, targeting adolescents and young adults, and evaluating their impact on health outcomes is essential, not only for evidence, but also to inform future strategies for utilizing digital health technologies. We therefore assess the adolescents and young adult-centered digital first health system in Nigeria by exploring the country's progress towards the digital health initiative. So the method we use for this studies, such as PubMed and Google Scholar, then to broaden the scope of the review, we incorporated additional data sources, such as not peer-reviewed materials, published articles, press releases, conference presentations, and we visited the organization website. And after collecting the existing data, we combined and compared the information and also went further for data analysis. from the analysis, we realized that a total of 11 digital health initiatives were identified. And these digital health initiatives, they are primarily implemented by private sectors. Findings were analyzed using three main themes that emerged from the data we collated. And the three main themes are health focus and strategic approaches, digital platform utilization, program maturity, and scope. So from the results, we found that we would see that the digital platforms that are mostly used to provide adolescents and young persons with health information and services, they are either using existing digital platform or they created their own digital platform. The main health focus these organizations focus on is sexual and reproductive health. Then most of the projects are time framed. That is, they are time bound. They have specific time they are meant to be completed. It's only one organization called Education is a Vaccine that has a continuous project for adolescents and young persons. So this study emphasizes the growing potential of digital health initiatives to address the health needs of adolescents and young persons in Nigeria. Next slide, please. And it's also highlights the digital health initiative role in bridging healthcare gaps for this population. However, the identified digital health initiatives are largely time-bound programs other than comprehensive and sustainable interventions. They are also largely driven by private sectors. We therefore recommend that the government should integrate these innovations into national policies while fostering ownership where necessary to ensure long-term sustainability, equity, and broader access to digital health services. Thank you.
Thank you so much, Helen. So I think it's going to be the case for all of you that the presentations don't really do justice to the amount of research that has actually gone into your papers. I think one thing you didn't really have time to highlight here is that you actually also did some analysis of the kind of policy environment in Nigeria and all of the different sort of strategies and policies that the government has developed to support digital transformation of health systems. And then you note here that actually it's the private sector that's playing an incredibly big role in delivering digital health services. So maybe you can say a little bit more about how to bridge that gap in terms of the public sector's role in terms of shaping governance, but actually taking into account the role that the private sector's playing. Like, what did you find there?
Thank you so much, Louise. We realized from the study that it's actually the digital health initiative that's focused on adolescents and young persons currently in Nigeria that are driven by private sector. Now, to enhance this, it is important that that the government will start public-private partnership, and it's also important that these innovations are integrated into the national programs and policies.
Your sound broke up a bit, Helen, but I think what you were saying is that the private sector initiatives, the youth-centered digital health services have issues around sustainability. They're sort of dependent on funding, and the government's going to play a really important role in taking some of these initiatives to scale and ensuring sustainability. I think she's dropped off, but if anybody has any more questions about Helen's work, please put them in the Q&A section. And I see that we have participants from Nigeria as well, so feel free to share any reflections that you have. And while we do that, we'll move over to Anyesha, who was sort of exploring similar questions, but in a very different context of India. So Anyesha, over to you. Please tell us about the research that you were conducting around digital first health systems in India. Over to you.
Thank you, Louise. So as Louise was mentioning, I was looking at the evolution of digital health system in India, and also assess how youth-friendly some of the digital health interventions are for India, for the Indian youth. So Yeah, so as part of the methodology, I followed a mixed method landscape analysis, which comprised of a literature review of policy documents, peer-reviewed studies, and government reports related to the digital health interventions, which were sourced largely from an open Google search, Google Scholar, and the likes of PubMed, etc. This was supplemented and corroborated by key informant interviews with a few digital health experts working across various stakeholder groups in the Indian context, and a few in-depth interviews, 6 in-depth interviews with youth within the age group of 18 to 30 years of age in India. I used 2 frameworks. The first one was a WHO framework for classification of digital health interventions based on the application type, and this was used primarily to map the various digital health interventions that I was studying as part of this research. The second one was a youth friendliness assessment framework, which was an adapted framework from 3 different sources: the DTH-Lab's global blueprint on digital first health systems, WHO's research tool to measure the youth friendliness, and United Nations Digital Inclusion Checklist. So this assessment framework was primarily used to assess a few of the digital health interventions. So this was the assessment framework that I used. It comprised of 6 different parameters. These parameters were primarily to judge whether a particular intervention was conducive for the youth or not. The first parameter was a youth-driven development, which considered the involvement of youth at different stages of the development to implementation to monitoring of the digital health intervention. Next was equitability, which was about whether by design the intervention was avoiding any kind of discrimination, be it based on language, be it based on caste, age, gender, etc. The next was confidentiality and privacy. So this considered whether the intervention had transparent data policies, whether it considered user consent, and allowed for customizable privacy settings or not. Next was accessibility. So a bit of there was, of course, a little bit of overlap between a few of the parameters, but accessibility largely looked at whether by design there was enough language support, whether the infrastructure, the required intensity of internet, etc., was available to be able to allow the beneficiary to use the intervention. Next was availability, which primarily focused on the physical enabling infrastructure, whether the solution was suitable as per the infrastructure available to the beneficiaries. Last was affordability, which considered not just the cost of using the intervention, but also the cost of the infrastructure, be it the cost of data or the device, whether it was affordable for the beneficiary or not. Okay, so I'll just quickly talk about how the evolution of digital health systems occurred over time in India. So it started in the late 1990s, which started with a few pilots of telemedicine. So initially the focus was primarily on telemedicine, and a lot of pilot programs by the likes of Apollo Telemedicine Network, etc., was piloted in various parts of the country. This was followed by, since these pilots were very successful, this was followed by setting up of task forces, government task forces for creation of standards and protocols for telemedicine. Then we moved on to creation of or promotion of e-governance, which also included access to digital health services, primarily telemedicine, through common service centers, which were like kiosk-like models in rural parts of India. The digitization of health information tracking systems also began around this time, where primarily data related to the primary health programs were digitized, along with even disease surveillance systems. The next phase focused on development of a lot of policies and regulations. The protocols for telemedicine services were set up around this era. With the improvement of infrastructure and technology, we also saw a shift towards creation of strategies for nationally shared digital infrastructure. So things like standards for electronic health records, the creation of National Digital Health Blueprint, which was focused on designing how the digital health IDs would be created, how can we have a health claims registry, how can we integrate the health facilities on a single platform. All of that was detailed out in the National Digital Health Blueprint in this particular time period. Then we moved on to COVID and post-COVID era, which was where a rapid adoption happened. Based on the National Digital Health Blueprint, the Ayushman Bharat Digital Health Mission was launched, which included, which basically implemented and saw the implementation of the Digital Health Blueprint. And then there were a lot of health solutions that were also implemented around this time on the likes of Arogya Setu, CoWIN, etc., which were primarily focused on symptom tracking and also immunization related to COVID-19 pandemic. Of course, they were later on repurposed and have been expanded as well, which we will see in the coming slides. So in a nutshell, if I just summarize how the evolution looks like. So in terms of policy and frameworks, so if we look at the policy focus, it was, of course, it started with a lot of heavy focus on telemedicine and on different fragments of digitizing various systems within the health ecosystem. And it led to a shift towards centralizing and integrating different parts of the health ecosystem, which is where the Ayushman Bharat Digital Health Mission came in. So that was the shift that we saw in terms of policy. With this, the focus also currently is on centralizing digital health data and creating personal health records for the citizens. Coming to the supply side considerations, so if we look at the implementation bit, the capacity building and the motivation between both private and public health workforce seems limited. If we look at the overall infrastructure, so one of the challenges is we're talking about two things. One is the health services itself and then the digitization of it. So India does suffer from issues with overall health infrastructure, so which also somewhere hinders the digitization process as well. So a lot of focus is required on enabling the infrastructure itself for digital health. Privacy issues still remain, and we'll see a little bit of more details once we go to the assessment part. Yeah. Coming to the youth, where does the youth stand within all this? So yeah, coming to the youth, if we look at the focus, so the health ecosystem currently caters to larger population instead of focusing on certain demographics or focusing on needs of the specific demographic. The emphasis is largely on optimizing the overall ecosystem instead of creating targeted solutions. And the involvement of youth also seems minimal at various stages within the digital health ecosystem development. Coming to the demand side, of course, one size doesn't fit all, and we need to be careful as to when we're talking of digital health, we see it as an enabler rather than as an end result. So what do we digitize? What parts of health do we digitize? That needs to be customized as per the health service. Health literacy, digital literacy, and the digital divide remains a big concern. So that is something that needs to be taken into consideration. And lastly, the awareness and clear awareness amongst the beneficiaries is also another thing that is limited and needs to be amped up. Next slide, please. So coming to the health solutions. So as part of my research, I focused on the health solutions that are being provided at a national level by the central government, which is why you can see a few eight to 10 interventions listed around here. So the first two, eSanjeevani Health and Wellness Center and eSanjeevani OPD, are the telemedicine services. The first one that is being provided from that basically caters to doctor-to-doctor consultations between rural to specialty centers. eSanjeevani OPD is a telemedicine service which is directly available for the beneficiary to talk to a doctor. Telemanas is a tele-mental health service that can be used for seeking any kind of counseling or psychiatric consultations. Arogya Setu initially was a contact tracing and symptom management app for COVID-19, but currently is a multifaceted app that allows various functions like registering, creation of a digital health ID, maintenance of personal health records, etc. CoWIN initially was allowed for booking of immunization, vaccination slots for COVID, but now it has been repurposed and has been expanded to the larger immunization program and includes other vaccination programs as well. Abha app is another one which allows you to register and create a digital health ID and also maintain your digital health records. Online registration system is part of a larger hospital management information system, which allows you to book appointments with the respective doctors and also manage your prescriptions and lab reports, etc., that have been generated as part of in a particular health facility. Lastly, e-Raktkosh is an e-blood bank management system which talks about which basically looks at the workflow across blood banks in India and allows one to track availability of different bloods across different blood banks and also register as a donor, etc. So this is like largely a mapping of, this was an analysis that I had done for all the interventions that I spoke about across the 6 parameters. I'll not go into the details of each and every aspect, but if you could just go to the next slide, I would give you an overview of what we found for the different interventions. So the first one, talking of the youth-driven development. So no platform was built with any particular youth engagement or input. So this was a finding that I had based on the available information out there, but also based on the interviews with experts as well as the select number of youth that I spoke to. With respect to privacy and consent, so whereas the privacy policies and the data security policies do exist for some of the interventions, but the clarity around them is a major issue across most platforms. Also, the customizable privacy settings is something that is also very limited in most cases. Coming to availability of services, it is mostly inconsistent, and that is not because of the service itself, but more to do with the platform's requirement for smartphones and internet. Because of because of issues with that, although the penetration has gone very high in India, and it's almost around, I think, 70% now for smartphones, but still, like it still leaves out a major chunk of the population, especially in the rural areas. Lastly, digital exclusion remains also a concern for marginalized youth and in rural areas, similar to the point that I spoke about availability. And yeah, lastly, data sharing transparency is also not user-friendly. So based on my interactions with the youth, that notion or that trust in whether their data is secure or not on the platforms was a major concern that came out. So just summarizing my overall findings. If we talk about the India's digital health ecosystem, so definitely it has evolved over time, and we are moving more towards consolidation now. And focus is largely adult-centric, and that is like a larger population instead of a one specific group. The youth engagement gap is something which definitely needs to be solved for, and it would be crucial for inclusivity. We need to adopt a participatory approach, which is focused on digital literacy improvement and also enhances youth-specific interventions. The reason I point this out is because during my interactions with the youth, one of the things that I also came across was that their understanding of digital health intervention is very much limited to the health information that is available out there related to, let's say, fitness or overall health and well-being, and finding health personal related information. But the scope of digital health is way more beyond that, and that is something where awareness also needs to be created. And of course, future research we need to focus more on how the adoption patterns are, what the user experiences are among the youth, in order to be able to scale and design, basically enhance adoption of digital health ecosystems within the youth. That's all from my end. Thank you.
Thank you so much, Anyesha. I don't know if we can just go back 2 slides just for a moment, because I think we had to gloss over that slide with so much detail about the youth friendliness, there we go, of all the different digital health interventions. I think it's really striking, like listening to Helen and your presentations, the very different approaches to digital transformation of health being adopted in Nigeria and India, and how every country is following a very different path. But there are sort of common challenges across these two and other countries as well, I think, in terms of, you know, youth involvement and youth being considered in the development of digital health interventions, whether they're specific apps or, you know, countrywide policies. We're a bit behind time, Anyesha, but just to quickly ask you, like, what do you think are some of the major barriers to having more like youth engagement in India's digital transformation processes and these different platforms? Like, from your interviews and research, what do you think are the main blockages?
So one of the blockage in terms of adoption, two rather, right? Like something that I spoke about. One was awareness as to what exists out there. So especially if we talk about not just like the government-led intervention. So one of the things that was very striking was very limited awareness around most of these interventions, which of course did not translate into usage of these interventions by the youth. So awareness was one of the things that was extremely striking, and can be one of the and is probably one of the barriers in terms of enabling youth to adopt some of these interventions. Even if we speak about private sector, I mean, the interventions being provided by the private sector, there also it's very limited as to what the idea of digital health is, as to what's there out to offer. So definitely awareness is something that is one of the major barriers. The second was also the concerns around privacy and confidentiality of data. That was a major concern among the youth. So that again is one of the barriers, which I think Rupal will definitely talk about the concept of trust in her presentation. But that notion of that trust, whether my data is safe or not, am I comfortable enough to share like crucial information related to some of very personal things related to my health? That was something which was definitely a striking finding as part of my research.
Great, thanks, Anyesha. There are a couple of questions for both you and for Helen and some of the others in the Q&A box. If you could answer those about the literature reviews that you carried out and sort of additional research that you would like to conduct on the basis of your work. So if I can ask you to tackle those live while we're continuing, I'd love to hand over now to Racheal, who looked at the topic of digital health citizenship, which follows very nicely from what Anyesha said about how can we empower and inform more young people so that they can take part in the design of future digital health solutions? So, Racheal, welcome. Over to you to tell us about the research that you conducted.
Thank you, Louis. So, hello, everyone. I'm Racheal, and today I'll be presenting my research on digital health citizenship, in which I mapped existing digital health and civic literacy tools for young people. Okay, so basic understanding of digital health citizenship or digital citizenship for health. It provides a framework for combining efforts to enhance digital health and civic literacy. Let me say in simple terms, it's about empowering young people, particularly with the knowledge and skills that they need to navigate health and governance in digital health. And the aim of digital citizenship is to equip the next generation to meaningfully participate in governance structures. And this isn't just about understanding policies, it's about co-creating positive health futures together and also ensuring that everyone has a voice. We can achieve this through evidence-based interventions, including the development of digital health citizenship tools. But to better develop these tools and resources that meet the needs of young people, we need to check if there are already available tools, and the available tools and resources, are they meeting the needs of young people? So to achieve that, the set objective for the research, we identified and evaluated global, regional, and national tools and resources that promote digital health or civic literacy using a walkthrough method. And walkthrough method is like making use of the tools or resources from a user point of view. Okay, following that, we did like an assessment of strengths using set criteria. So we had set criteria from young people, what they want to see in tools, and also our own set criteria, what it is that we want to see in the tools when we are assessing the tools, and just so that we can identify the gaps and make recommendations. Next slide, please. So following the walkthrough of several tools, we identified several digital literacy, health literacy, and civic literacy tools. A total of 38 tools were identified, most of which were digital literacy tools. There were lots of digital literacy tools. We also had health literacy tools as well, but quite a few civic literacy tools, especially global civic literacy tools. So after identifying the available tools, we went ahead to do assessment of strengths. Okay, so what are the features that the tools have? Do they address digital literacy? Do they promote health literacy, civic literacy? Do they promote one or all three forms of literacy? Do they build knowledge and skills? That's capacity building. Then we also went on to check if they had user-identified values and features. And these are they equitable? Are they inclusive, trustworthy, humanistic, ethical? Do they have quality personalized services? And do they connect everyone together? And are the platforms user-friendly? So following the identification, we did the assessments, strength assessments. And after the strength assessment, we were able to, not all tools, we just identified about 5 tools that actually met significant percentage of the set criteria. At least maybe they met about 9 out of 13 criteria. And some of the tools include Colibri, because it was designed for young people. It had global access, multiple languages. It's not limited to internet. You can just basically install it on your laptop and pre-download the resources that you need. And you can even use it when you don't have internet access. It is private because you can log in, you can personalize the things that you want from the tools. It allows different forms like reading, listening, library, bookmarks, channels, and it's also very user-friendly. But some of the criteria I did not meet is humanistic. And when we are saying a tool being humanistic is, does it have, the human touch where it makes you feel like, oh, I'm not interacting with robots, and it just makes you feel that way? Does it connect everyone together? Like other people using the tool? Does it have quality personalized services that are personalized to you yourself and not just general information that is available to everyone? And there were other tools as well. Most tools that were humanistic were mental health tools. I think they tried the mental health tools and resources that I found. They tried to incorporate humanistic features like maybe forums where you can call someone, hotlines, text lines, chat lines, and all of that. So at the end of the research, they identified gaps where many tools are not fully equitable or inclusive. Like I mentioned earlier, they lack accessibility to multiple languages or formats, that's excluding individuals with disabilities and people in low resource setting. And that was what I mentioned about Colibri, because you can install it and use it without internet, which I think Colibri was the only one that could do that. Most of the tools, it requires internet access, and it's not every area that has the luxury of having internet all the time. Then only mental health related tools were humanistic. Most tools don't address all forms of literacy. Most of them were either addressing digital literacy, health literacy, or civic literacy. There were tools that actually address digital and health literacy or digital and civic literacy, but no tool has been able to, address all these three forms of literacy together, and most were designed for knowledge building with little effort placed on skill development. So going forward, some of my recommendations were to, to avoid a one-size-fits-all approach. More research should be conducted into the specific cultural expectations and digital needs of various regions, because we cannot use the same ideas that are used to develop tools for developed countries, develop tools for low and middle income countries. So there needs to be a way to make sure that all of these ideas are put together to develop a global tool that can be used in all areas. Then also prioritize user-friendly and visually appealing designs. These tools are going to be designed for young people, and they need to be visually appealing. Involve young people in the design and management of the platform. Because if you're going to co-create a tool with young people, you need to involve them in the tools that you're making. Then collaborate with schools and local organizations, because it is one thing to have a tool, wants to improve your tool, and it's not being used, or nobody even knows about it. So I think that's all for my presentation. Thank you.
Thank you so much, Racheal. A quick follow-up question from me to you is that you're probably one of the few, maybe the only person in the world who's actually now studied all of these different tools and resources that are out there for digital health citizenship. Do you, having looked at all of these resources, do you now feel like you are close to being a fully empowered digital health citizen yourself, or what would you now say are the biggest gaps in your knowledge and skills that you'd want to fill?
Well, I think I know to some extent, but it's not about me knowing, it's about people knowing. Because like you mentioned, I'm maybe one of the people that have actually explored these tools. And when I try to communicate, I'm working on incorporating digital health and civic literacy, it's not a concept that people are familiar with. And I think that is maybe a major gap. There should be a way that we incorporate these three forms of literacies and also get young people involved in participating in more research, more activities, letting them know the importance of developing a tool for this or that purposes. So, yeah.
Thanks, Racheal. If anyone else has got any questions, please put them in the chat or the Q&A. And we'll hand over now to Rupal. As has been mentioned, you've been looking at this very critical concept of trust that I think has come up in every piece of research that the other fellows have done for us. But we asked you to help us really understand, what does trust mean in the context of digital health systems? And how can we better understand it in order to help improve people's trust in digital health ecosystems? So over to you, please, to tell us about the research that you've conducted.
Thank you so much, everyone, for being here. So with DTH, I worked on trust in digital health systems, especially focusing on exploring barriers and enablers among youth. Next slide, please. So as we all know that digital health encompasses the use of technology to deliver healthcare services and manage health-related data. And it has numerous benefits, including universal health coverage and all sorts of things. However, next slide. However, there are certain kind of barriers to its adoption, which mostly includes digital access, majorly in low and middle income countries. However, there has been found notable hesitancy as well in usage of such technologies. And coming on to why are we focusing on youth and digital health? So because of the pervasive engagement of youth with digital technologies, as well as there's a report by UNICEF which found that inaccurate health information and concerns about privacy were the major barriers among youth, which actually stopped them from engaging with digital health technologies. So for this study, the major objective was to identify the factors enhancing and undermining trust in digital health systems among youth. For that, we first conceptualized trust, exploring different kind of theories, frameworks, and models around it. And using those frameworks and theories, we try to understand trust in regard to digital health systems. And we actually used a model, Mayer et al. Trust model for that. And post that, we actually went on to exploring different factors that enhance and undermine trust in digital health system, focusing majorly on youth. So for that, we actually we searched two databases, PubMed and Google Scholar. And the search term included digital health, mHealth, telemedicine, and everything in combination with keywords like age, youth, and trust. So the findings employed a conceptual analysis using Mayer et al. Trust model. Next slide. Yes, so coming on to trust as a concept, as we know that it's very complicated construct to define in operational terms. However, theorists have defined it including two parties, a trusters and a trustee. It can also be called a three-party relationship, which involves two actors, which I already mentioned, and one act. One act is also very important because we'll talk about it later. So according to theorists, trust is the willingness of a party to be vulnerable to the actions of another party based on the expectations. Regarding trust, we came across this model by Mayer et al. So it talks about how the proposed model of trust not only involves trustees' characteristics but also trusters. As you can see, trustees' characteristics involve ability, benevolence, and integrity. And there's also some kind of influence of trusters' propensity on the relationship building of trust, in addition to contextual and environmental factors. So now that we have understood kind of components of trust building relationship, in regard to digital health ecosystem integrity, we could say that it is adherence to set of principles that the parties have agreed on, which includes transparency, user control, and autonomy. And then for perceived benevolence, it could be demonstrating good intent and providing a personalized experience to the user. Then we have ability, which can also be understood by service providers that are associated with reputed organizations or the past success are considered to be more able. And then we have trusters' propensity, which is the natural tendency to behave in a certain way, which can be influenced by various factors, including age, education, or any other kind of social demographics. Then we have perceived risk, which includes security and privacy, and reliability and accuracy of the technology we are using. Next slide. Yes. So now that we have kind of understood the trust as a concept in regard to digital health systems, we have kind of tried to bifurcate some of these factors in relation to truster as well as trustee. So these are found through literature. It was very interesting that age was also one of the major factors which was actually depending the trust. We found that younger generation were mostly hesitant because of trust issues to use digital technologies, while older people were more concerned about the perceived ease of use around digital technologies. They were more concerned about usability of the technology rather than potential breaches or security. And then we also found that education and occupation were also related to trust. Because there were studies which said that people who were more educated were more concerned because they were more aware, so they were more concerned about the possible breaches in the security and privacy. So that is why they were more hesitant to use those technologies. Similar with the people who were working in the field of healthcare facilities, because they were more aware of the possible breaches, so they were finding it difficult to trust the technologies. On the other hand, there are factors related to data usage, privacy, then intention and capability of the trustee. For example, in a study, it was also found that the study was conducted in Australia, where the users were not actually trusting the trustee because of the intentions of the trustee being related to a political party, and there could be malicious activities going on in the background, and that is why they were not very sure of the intention of the data fiduciary. That is why not being a very trust worthy of the usage. And then we also have the technology which is being used, artificial intelligence and algorithms, and the validities of all those sorts of things. And then we have the design and credibility of the platforms, websites, applications of the matter. Then we kind of spread out these factors that we just talked about in factors that undermine trust and factors that increase trust. Also, one of the points that I missed in the last slide was, there was nature of the act also involved. It's important to understand, because it was found that, what kind of act is happening is also very important. As, for example, in our study, it was found that sensitive information, people were not able, comfortable sharing it online. So in those sorts of things, they were not actually relying on digital health services. Rather, they would want to go out and meet someone face to face and have the problem solved. So the nature of the act, what kind of problem it is, what kind of health related situation they are facing. So that also depends on determining the trust. So coming on to factors that undermine and increase trust, there factors that undermine trust are privacy concerns, lack of security of data, perceived incompetence and intention of the trustee, which we just talked about, past history of malicious activity of the trustee. And then we have truster's occupation in the healthcare, which makes them highly aware. However, even if it undermines the trust, we do not want people to be not aware of the possible breaches, because that would make them exploit, that can actually be exploited against them by the big data companies. And then lack of anonymity. These are the factors that undermine trust. And then we have factors which increase trust, includes transparency and accountability, credibility of the source of information which is being provided to the truster, then design of the website and application, capability of the technology being used, if it's been through a continuous testing or not, truster with low level education. Again, this is something which we do not want. Even if it increases the trust, we would want the truster to be more capable of actually making informed decision if they want to use the technology or not. Then we have strong security measures as well. So what we observed, more or less, that high-income countries have or are in the process of acknowledging trust as a barrier to adoption of digital health technologies. However, low and middle-income countries are still far behind, because they are still focusing on digital divide as a barrier to universal health coverage. So there's a long way for low and middle-income countries. However, there are certain policies which are in place, which kind of promoting security and privacy overall. Thank you so much, everyone, for listening.
Thank you so much, Rupal. I think you've really helped to illustrate what a complex issue this is, that we both need to help young people and others feel that they can trust digital health solutions, but also on the other side, there are many things that can be done to make them more trustworthy. So I think a question for you, and I'm going to also ask the same for Anyesha and Racheal, is like, based on the research that you've done, like what is the number one like urgent priority action that you would like to see policymakers or others take to help address some of the issues that you've presented on?
I think there would be two sides. First, educating the youth as well as like common people to use digital technologies, and they can make informed choices. At the same time, I would also want to have a clear, comprehensive policies that protects data principles, data and security. So we should be working both sides, trusters and the trustee.
Okay, so it's definitely not one or the other. Thank you, Rupal. Anyesha, what would you say? What's like your number one takeaway action from the research that you did?
I echo with Rupal's thoughts. Since like a lot of concerns of the youth was around the data privacy, definitely that would be one of the most important action area for me when it comes to the policymakers. So assessing what is it that is leading to the issues or the lack of trust in the data privacy frameworks and identifying what could be the solution for that.
Right. Thanks, Anyesha. So I think, unfortunately, Racheal and Helen have disconnected. So I can't ask them that same question, but I invite everybody to read their papers and to read Rupal and Anyesha's papers to really understand the rich data and insights that they were able to capture for us. If anyone has any follow-up questions, you can channel them through us and we will pass them on. And I think that just really leaves me to thank you all so much for the months of amazing hard work and the contributions that you've made to DTH-Lab's work going forward. So really thank you from everyone. And with that, I just want to say thank you again to everyone who's joined this webinar. Thank you to our research fellows. And we look forward to continuing our collaboration with you all. Thank you, everyone.